Really, people are very good at just managing and thinking, well, I'll make do, or finding their own way around things. People don't always think they're entitled to anything. They don't know who to go to. But an assisted living lab like this is open to anybody. Doesn't matter what their condition is, doesn't matter what their disability is, doesn't matter if they've lived with it all their life or it suddenly happened to them last week. They can pick up the phone, they can come and see what's available, whether that's for living with dementia or whether it's living with a physical condition or a hearing loss. There's so many things out there, so where do you go to find out and try things? And that's the difficulty, trying things. You can see it on the paper, but it doesn't necessarily mean that it's going to meet your expectations.
Centre of Excellence for Technology Enhanced Care will be establishing a living lab, and this living lab will be a physical environment whereas we will be integrating technology into someone's living environment. This will be of a great opportunity for our students and our partners from industry and from health and social care professionals, or from the commissioner point of view, because really that the living lab facility will demonstrate the equipment, how it could be used, and that will allow them to visualize the changes that might be impacted on the individual's life and into the commissioning of future services for individuals with long-term condition.
My husband doesn't really need a carer as such. He's quite mobile, he can think for himself, and the only thing is that because of his Parkinson's, I'm worried about his falling over. And so this would give me added security, definitely. I specifically, in my case, I would feel safer. And having looked at the camera system here and the security here, I would feel a lot safer when I do go out and I leave my husband at home on his own, and I'd be able to keep a track of what is happening. And if he could connect the camera to some kind of a system, even if it's on my phone, then I'd feel a lot happier and safer.
So another good thing about the Living Lab is it provides us with a base where we can hold focus groups, and we've done quite a few now where we've had companies come in with ideas, and we've brought in people in the area who are living with different conditions to talk about what they want and how things might work, to talk with the people that are developing these bits of equipment and the clinicians. So we get a good group together, we get some really good ideas come out of it. The clinicians and the developers seem happy because they're not going down a blind alley. And the users love to feel they're giving an input, because that ultimately we're the ones that are going to be using it.
Technology is a new concept to a lot of healthcare and social care professionals. Therefore, it could be a challenging factor in the way that they actually deliver the care and how they deliver it. And therefore, establishing centers such as CETEC is hugely important, because that will be able to bring these individuals, professionals together, bring commissioners as well, bring clinicians, and even let me call them patient or client, together, trying to understand and trying to actually establish the need of these individuals and how technology could actually fit with these clients' care pathways. Looking into the future, trying to really allow the patient or the client to be more involved in their health and social care, so they become more aware and understand their condition, therefore they become more involved in their self-management. Again, the use of technology and the use of a specific system that allow to transfer clinical data from someone's home to a clinical center via the internet, etc. It allows us as health and social care professionals and even commissioners to understand someone's well-being or someone's health behavior within the home, and therefore that will allow us to sort of have a roadmap into the future needs of the actual population that we're dealing with.
I have been spinal cord injured since 1980. I fell 20 feet in a gym at the age of 17 and unfortunately missed the crash mats. So it was really tough. As a 17-year-old, I was training to be a police officer, and that's what I wanted to do. It was a family career. And so when you're lying in bed, and I was in bed for 3 months recovering from the break, all you can see are the things that you can't do anymore, and I couldn't see what I was going to be able to do. I went back to live with my mum and dad. I'd kind of been living away during the week at the training school, and finding my feet, and then suddenly I had to go back and be the child back in the house. Mum and dad had to have the house adapted, obviously. The dining room downstairs became my bedroom, and on one side of the kitchen they had a much lower surface put in with a small hob and a small sink, so that if I wanted to cook anything, I could. I went to a rehabilitation centre in a hospital, which was great. It wasn't a specialist rehabilitation place, but they did have a kitchen laid out, which I could try. But it was all white melamine. It was really cheap, and it wasn't something Mum and Dad wanted in their house, and it wasn't something I ever wanted in my house either. And that was about the full extent of technology, if you like. It was just a lowered surface. When I got married and we moved out into a bungalow, and we obviously needed a new kitchen put in that, again, there weren't places you could go and really see accessible kitchens. We didn't have the internet. I didn't belong to an organisation like the Spinal Injuries, so I didn't get magazines coming through the door showing me what was available. So I went to a local kitchen company, and they came in and we agreed that they would put the kitchen cupboards in without the plinth, so they would be much lower, and the surface would be much lower, but I did everything side on. The hob was there, I cooked side on. The sink was there, I cooked side on. Then I needed more surgery on my back, and I was told that it was unlikely I would be able to twist. Now, if I couldn't twist, I couldn't do anything. And that was then the wake-up call. So I had to go and ask to borrow money from various sources. And for the first time ever, about 25 years after my injury, I actually got an actually adapted kitchen. And I can remember wheeling under the hob and stirring something in the saucepan and thinking, oh my God, I can actually see what I'm cooking. That was quite a revelation after 25 years.
We will be looking at developing evaluation frameworks where we're going to be looking at existing technologies, look at ways of how this technology having an impact on the individual's life, into the relative's life or next of kin, even into the carers, and even further that to that as additional point is to examine the financial impact into the cost of care for these individuals. And again, that will be us working closely with health professionals, with social care professionals, commissioners of health and social care, as well as with the industry itself. And most importantly, to be central to all of that is the actual clients or individuals who's going to be using this technology.
Specifically brought us here was because my husband is very much into computers. Because of his physical disability, he does spend a lot of time working on computers. He's written a couple of books as well, and we could see recently that he's getting more and more limited with the use of the systems we had at home, and that was one of the main reasons we've come here. But very pleasantly surprised at the number of other systems that we've been exposed to this morning.
So this it's a sensor floor mat, with sensors attached, embedded inside it. So the minute that Hassan stands, that will be alerting me as a carer or as a next of kin that he's trying to get out of bed. So the minute he stand, there's a light would be flashing in here, and this will be linked via Wi-Fi or wirelessly to a pager to tell me that he's out of bed or he's trying to get out of bed. Whatever technologies we are developing or evaluating or bringing into the care pathway, integrating it into the health system or social care system to make sure that it's fit for purpose. That's actually achieving what meant to do for these clients in managing their condition.
For me, it's not just about having an accessible kitchen. The bathroom is equally important, and knowing what's out there, what's going to make my life easier. But I want a bathroom that looks like a bathroom. And if you go into an NHS hospital or a rehabilitation centre, they're still clinical places and they need to be kept as clinical places. But I don't want to live in an institution, I want to live in a home. I want things to look normal as possible. And this is great because it looks normal. It looks like a normal kitchen, it looks like a normal bathroom. So I think it just opens people's eyes up to the possibility of having an easier life without compromising and feeling like you've just swapped one institution for another. And that goes across all disabilities and all conditions, because we all need a little bit of help with something, whether it's your vision, whether it's your hearing, whether it's a physical condition.
I think CETEC is crucial towards the linkage, or towards the bringing together health and social care, generating a discussion between them, facilitating a discussion, facilitating initiatives that could be taken forward through innovative ways or innovative ideas of care delivery, and how it could be evaluated, and how the evidence could be presented, whether that in conferences, whether that in publications, really to ensure that technology is well received among individual who needs it, among health and social care professionals actually using it to monitor or to promote the quality of life for these individuals in the home.